Hello everyone, let's study about P wave morphology in today's video. We know that P wave signifies atrial depolarization and it is positive in most of the ECG leads except for AVR where it is inverted and V1 where it is biphasic. So the normal duration of P wave is less than 3 small square box, that is, it is less than 120 millisecond, which is signified in x-axis, and the normal amplitude of P wave is less than 3 small square box, that is, it is less than 2.5 millivolt, which is represented in y-axis. So to understand about the pathology of P wave, we have to have keen understanding about its genesis. We know that SA node is close to right atria. So when it fires, it brings about right atrial depolarization, which is represented by initial 1/3 of P wave. After that, right atria and left atria simultaneously contract, which is represented in middle 1/3. And as left atria is comparatively larger than right atria, it takes longer time to depolarize. So the last 1/3 of P wave is contributed by left atrial depolarization. So with this basic understanding, let's learn about some of the P waves and P waves pathology. So we know that whenever pulmonary hypertension is caused due to COPD, hypoxia or interstitial lung disease, there is activation of hypoxia sensitive potassium channel that brings about pulmonary vasculature constriction, as a result of which pulmonary pressure increases and right ventricle hypertrophies, and eventually this leads to right atrial enlargement. So from what we've studied, we can figure out that due to right atrial enlargement, the initial 1/3 and middle 1/3, that is initial 2/3 of P wave gets affected, as a result of which amplitude of P wave increases, and this give rise to tall P wave with amplitude greater than 3 small square box, and this is known as P pulmonale. Can you figure out why we have named it as P pulmonale? Because most of the time it is related to lung pathology. So whenever there is mitral stenosis or mitral regurgitation, there is concentric or eccentric hypertrophy of left atria, and as we've studied that left atria mainly contribute to the last 1/3 or last 2/3 of P wave. So whenever left atria enlarges, initial 1/3 is fine, however the later 1/3 of P wave becomes unduly prolonged, and it results in increase in duration of P wave, which gives rise to P mitral, that is P wave, the duration of P wave is greater than 3 small square box. And if we want to understand about the right atrial and left atrial enlargement more specifically, we can look at lead V1. In the case of right atrial enlargement, the positive wave, which signifies right atrial depolarization, becomes large compared to negative wave, whereas in left atrial enlargement, the positive wave is normal, but negative wave, which signifies left atrial depolarization, becomes large. Thank you.